unless you want me to.
Okay. Hello, thank you very much for joining us today. We'll just wait for some additional media to attend. If you wouldn't mind just staying muted. Good afternoon, everyone. Thank you for joining our media briefing today. We are joined by Dr. Joyce Locke, Medical Officer of Health at Southwestern Public Health. She will provide a brief statement, and then I will open it up to questions. I'll now hand it over to Dr. Locke.
Thanks, Natalie. Good afternoon. I'll start today's media briefing with a look at our most recent data. Today, we have 7 new cases, bringing our active confirmed positive cases to 78. We have 3 people in hospital now, and that as due to COVID, and 1 person is in the intensive care unit. None of our long-term care homes or retirement homes are in outbreak. A good indication of the power of vaccination, for sure. We have 20 active cases of a variant of concern right now. This is about 1/4 of all cases in our region at the moment. And across the province, more than 50% of cases are screening positive for a variant of concern. And 1 week ago, it was 30%. And this just shows how quickly these variants are spreading and becoming the dominant variant. Locally, social events are a significant source of spread in our community. We've come out of winter hibernation into the orange zone of the provincial framework, and this has resulted in many types of social gatherings happening, and these social gatherings have resulted in our increase in cases. So a little bit more about the vaccine. So the good news is, as we see more variants, we are also seeing an increase in the number of vaccinations given each week. Our dashboard is reporting over 5,000 residents who are at least partially vaccinated with 1 dose as of March 13th. Through our clinics and our mobile efforts, we're administering up to 800 doses a day currently. We are also in our 2nd week of operating our mass immunization clinics, the one in St. Thomas and the one in Woodstock. The feedback from those who have attended the clinics has been very positive. Booking is a challenge, and we understand that, and this is because of the high demand for vaccine. We are very happy that people are seeking out the vaccine, and we would look forward to making this process of booking as smooth for everyone as possible. We continue to work with our partners to improve the online and phone booking experience. Mobile clinics are underway at the moment at our congregate living settings. That means we team up with our EMS partners to deliver doses to these settings. We anticipate that this will take 2 weeks, and then the mobile teams will start to reach out next to homebound seniors in our community. So if you're a homebound senior, do know that we're going to get to you sometime in April. There will be vaccine for everyone who wants it, but it will take time and patience from all of us. With more doses will come more appointments. At the moment, this is a supply and demand issue, and our demand locally well exceeds our local supply as to what we're getting from the province. And this is not just here in Southwestern Public Health, but for all health units across the province. There's been a lot of information in the news recently about people traveling outside their health unit region to be immunized. I do encourage residents to get vaccine in our local community or through our workplaces when they become available. However, since Ontarians may receive health care anywhere in the province, including vaccines, you are free to travel to get vaccine. I also want to stress that individuals should accept any vaccine brand that is offered to them unless specifically advised against a particular manufacturer by their healthcare provider. Ultimately, all the vaccines offer the same important features. They prevent infection, or they cause an infection that is less severe, and this decreases illness, hospitalization, and death. And these are our three primary goals. So moving on to talk a little bit about schools. School cases are on the rise. As in the past, what is happening in the schools is reflective of what is happening in the communities around the schools. We currently have 7 schools with at least one case. 2 are in outbreak. Public Health does an investigation and performs the case and contact management. We provide guidance to the schools about how best to contain the spread. At St. Michael's and St. Patrick's in Woodstock, quite a few students, staff, and family members needed to self-isolate to contain the spread. The London District Catholic School Board made an operating decision to close the schools for 2 weeks. We recognize that this is a difficult time for families. We all want children in classrooms learning, but we must balance this wish against further community transmission, particularly now with the variants of concern that spread very rapidly. So the key messages pertaining to our schools are that we really need the parents to complete the daily screen. This is critically important. If your child is symptomatic, even one symptom, get tested. If you are identified as a high-risk contact in the letter you get from Public Health, we ask that students get tested on day 7, and adults are recommended to test right away and again on day 10. So just in closing, what we all do now affects not only ourselves, but the whole community. It's in each of our hands to prevent another lockdown. The summer is coming, the days are getting warmer, and we all hope to have a more open society where we can engage in those activities we enjoy. We can only do that if we keep our case numbers down. So I encourage everybody to stick with their small bubbles, even though we have the urge so strongly to be out and join parties and get back to the old ways. Just for a little longer until we get all of us vaccinated. Let's do our thing. so that we don't need to head into the lockdown as the days get warmer. And I'm handing it back to you, Natalie.
Thank you, Dr. Locke. We will have time for 2 questions each today. Please remain muted until you are called upon during the question period. We will open the phone line to phone number ending in 2670. Please identify yourself.
Hi, that's me, Kathleen from the Sentinel Review. Can you hear me all right?
Yes, Kathleen, I can hear you well.
Wonderful, thank you. Thank you, Dr. Locke. I was just wondering, with more vaccines and more people becoming eligible to get their vaccines, other parts of Ontario have expanded vaccine clinics to local pharmacies, for example. Is there any indication that that could happen in the Southwestern Public Health region yet, or what does the planning for that look like at this point to make vaccines available in community settings like pharmacies?
We have been informed that in the coming weeks, at least 3 pharmacies will be opened to provide the AstraZeneca vaccine in each health unit across the province. And so that they expect to open an additional 700 pharmacy sites, and then to double that to up to 1,500. So we are hoping that we will have 3, and then perhaps a little later another 3 at minimum. So that's what we've heard so far. I know that the ministry is looking at which pharmacies to choose within each health unit region, so that we can try and distribute where vaccine is where people can find vaccine. We can distribute that fairly across our large geography.
Wonderful, thank you. I don't have a follow-up question right now.
Thank you. We will now open it to phone ending in 6004. Please identify yourself.
Hi, Dr. Locke. It's Ian McCallum at MyFM.
Good afternoon, Ian.
Hello. My first question that I was going to ask has just been answered. That's about the pharmacies. But now that we've got the better weather here and people are outdoors, and there are many in this area, including young children, that suffer from allergies, that can bring on symptoms very similar to COVID, sniffles, runny noses, coughing. What's your suggestion to parents that may have children that are prone to ragweed or any other of the sort of airborne allergies out there?
So this is something that is always a challenge for parents, and it has been for the last year. Children get a runny nose for a variety of reasons, and right now, runny nose is one of those mild symptoms that does require a test if it appears to be unusual or new. So this is what we actually advise our parents. The school screening tool for COVID indicates that if a symptom is new or worsening, then the parent should consider COVID and get the child tested. So hopefully many parents already know if their children are prone to seasonal environmental allergies, and then know, oh, I've seen this before. Often seasonal allergies come with other symptoms such as red, itchy eyes or sneezing, and it looks just a little bit different than a cold, and a parent often can tell these two apart. So if it looks very familiar, like your child's allergies, then it's an allergy. But if it's a new symptom for your child, or it looks different than it usually does, or you're just not sure, then err on the side of caution and get your child tested.
Great. Thank you, Dr. Locke.
We will now open the line to Rob Perry, Aylmer Express.
Hi, Dr. Locke. I just wonder if you could speak just a bit about the fact that a health warning has now been issued, or a warning has been issued for the AstraZeneca virus by Health Canada about potential blood clots. Could you just outline why it's still considered safe to use?
So Health Canada is aware of the reports in Europe of adverse events following vaccination with the AstraZeneca COVID-19 vaccine. The COVID virus has been shown to increase clots in people who get ill with it. And so this was one of the side effects that people, that all of us were watching for. It appears at the moment that the rate of clots is no greater in those who received the vaccine than those who did not. So it means that we're not seeing any more clots than we would normally see. So at the moment, the direction is that the risk of serious illness from COVID outweighs any risk of clotting. And so in general, Health Canada continues to reassure Canadians of the benefit of the AstraZeneca vaccine. That said, they continue to monitor this very carefully, and locally, I monitor all side effects that of any seriousness to the vaccine. Our primary care providers know that they are to report any side effects of significance to me, and I review each and every single case. And this is all part of a vast network of reporting that's done locally, provincially, and nationally to ensure the safety of the vaccine.
Rob, do you have a follow-up?
No, that's fine. Thanks very much.
Thank you. We'll now open it to Shane Ketness, Rogers TV.
Oh, hi, Dr. Luck. How are you today?
Good, Shane. And you?
Very good, thanks. You mentioned advice from a health provider regarding receiving a certain type of vaccine. What would be the concerns there?
So there are what we call excipient ingredients in some of these vaccines. These are ingredients that are used to keep the vaccine stable or to keep the vaccine sterile. And then there are other ingredients that are used just to actually make the proteins in the vaccine. So some people have sensitivity to these ingredients. So we ask individuals to check with their healthcare providers if they have any history of allergy or sensitivity to medications or vaccines. Also, some people, their disease and their immune status or the medications they are on end up being a contraindication or a concern about the vaccine. So for people who are on some of these more complex medications, we do ask them to check with their specialist to get advice before they get the vaccine.
Okay, thank you. That's all.
Thank you. We will now open it up to Chris McMillan, Hard FM.
Hi, Dr. Locke. Thanks for taking my question. Easter's right around the corner. How nervous is the health unit, the province, everyone? How nervous are we about Easter? And there's probably going to be a lot of people who are going to get together no matter what the recommendations are.
To be honest, I am very nervous. We've seen quite a few cases develop in parts of our health unit. We do know that the majority of them were caused by socializing events between individuals who were not of the same household. I also know that we're very tired as a community of just being within our little small bubbles, and that Easter is often an event where we have a few days off. Often it's accompanied by good weather, and so that does lead to desire for increased socialization. So again, I urge people to just hang in there a bit longer, a few more months. and to avoid those larger gatherings as we go into this Easter. It's particularly important. We don't want those VOC variants to get ahead of us while we're trying to get ahead of them through our vaccine program.
Thank you, Chris. Do you have a follow-up question?
Just to follow up with that, what advice, I guess, would you have for people? And if people do get together, can you mitigate risks by being outside and not eating dinner, but, you know, at least meeting outside in the backyard or something like that?
So we did say last summer that it was better to get together outside. And it definitely is better because there's more air movement outside. And that makes it a little more difficult for us to catch virus from one another. That said, when we are socializing and we're chatting, we often move closer than 6 feet to one another. One, so that we can hear better, and two, because that's just the way we are when we're with another person. There's a sort of distance between the two of us that we're comfortable with. And now with the VOCs, we have noticed that they do spread very quickly in families. So if you're going to be outside, we still recommend even there that you use a mask now that we have the VOCs. And again, that you keep it as small as possible, because despite everyone's good intention, when you're out there together and having fun, you inevitably end up closer than 6 feet or 2 meters. So all in all, I hate to be the wet rag, but I strongly discourage those larger gatherings, even whether they're outside.
Thank you, Chris. I will now open it to Sawyer Bogdan, AM 980.
Hi, Dr. Locke. I joined a little late, so I'm sorry if you already touched on this, but I was hoping to get an update on the 2 schools that had to close down because of outbreaks in Woodstock.
So yes, we did have 2 schools in Woodstock, St. Michael's and St. Patrick's. There were cases there in staff, students, and family members, which affected multiple classes. And the London District Catholic School Board made an operating decision to close the schools for 2 weeks because there were insufficient students and staff to continue keeping the school open, considering how many cohorts were dismissed because of their exposure to those cases in all the classes and grades across the school.
Sawyer, do you have a follow-up? Sorry, go ahead.
Yeah, is the plan still to open them after the 2-week period ends?
Yes, so the outbreak will be declared over when we do not see any further evidence of transmission between students impacted by the original cases, and that usually is about 2 weeks. So we do expect to be open again after the 2-week period.
Thank you very much. That concludes our media briefing for today. If you have additional questions, you can email them to communications@swpublichealth.ca. Thank you all.